Hello everyone and welcome to this masterclass on the low back pain. So if you ever had back pain, you are not alone. Low back pain is one of the most common health problems people face worldwide. Most back pain is manageable, treatable, and often reversible with the right approach. Today I will explain why back pain happens, how clinicians assess it, what actually works for recovery, and how you can protect your spine for a long term. This is not a journey, this is a practical. This is not a theory, this is a practical knowledge for real life. So first, let's understand what low back pain really is. So your lower back is made up of, we have the vertebra. The vertebra are the bones that form the spine. Then we have the intervertebral disc. These are the shock absorbers. They cushion the vertebral bones. Then we have the muscles and ligaments. Then we have the nerves and the facet joints. So those are what made up the lower back pain. We have the vertebra, which are the bones. We have the intervertebral disc, which act as shock absorbers. We have the muscles and ligaments. We have the nerves and the facet joints. So pain comes from any of the structures that I have mentioned. It is important for patients to note that pain does not always mean that there is a serious damage. Many people recover fully without surgery. So what are the common symptoms of low back pain? Number one, we have localized pain. If the pain is located at the lower back pain. Then number two, we have stiffness. Number three, we have muscle spasm. Muscle spasm is involuntary muscle contraction. So if the muscles contract involuntarily, there's a catch and release. That is what it means, involuntary muscle contraction. Then there's pain radiating to the leg. It can radiate to the posterior side, anterior side, or on the inner thigh. So if pain radiates to the lower leg, then reduced mobility. What reduced mobility means is that you cannot do the normal forward bending, backward bending, and lateral bending as you used to. That is what reduced mobility is. So those are the common symptoms of lower back pain. As I repeat, we have localized pain at the back region, we have stiffness, we have muscle spasm, we have pain that radiates to the leg, and reduced mobility. So understanding this will help reduce fear, as fear itself can worsen the pain. So what are the causes of lower back pain? Let's break down the causes. So we'll break them down into the following. Number one, we have mechanical causes. So mechanical causes are the most common causes of lower back pain, and this relates to your posture, your movement, and your daily habits. Posture basically means your sitting habits, your sleeping habits, your walking habits, and if you have a car, your driving habits. So how you do those are under mechanical causes. Your posture, your movement, how you walk around, then your daily habits, what you usually do. So examples include poor sitting posture. So poor sitting posture, this commonly occurs in those who do office work, especially especially the secretaries and those who commonly engage in typing activities. Poor sitting posture. Number two, heavy lifting incorrectly. Commonly seen in manual laborers, they usually engage in heavy lifting activities, also seen in soldiers as they engage in wars, the veterans, so heavy lifting incorrectly. Then weak core muscles. So the core muscles are the muscles that help stabilize your trunk. So if they are weak, they will also lead to lower back pain. Then sudden strain or injury. If you have a sudden injury, an acute injury, or a strain. So those are some of the examples of the mechanical causes of low back pain. And this category accounts for most back pain cases. So what are some? I've said that the mechanical causes are the most common causes of low back pain. And this will relate to your posture, your movement, and your daily habits. Examples of the mechanical causes: we have poor sitting posture, heavy lifting incorrectly, weak core muscles, and sudden strain or injury. And this category will account for most back pain cases. So those are the mechanical causes of the low back pain. Mechanical causes of the low back pain, the most common causes of low back pain. Then we have disc problems. So your disc acts as a cushion. So what is a disc? A disc is basically found in between the vertebrae. So remember, within the spine we have the vertebra. So at the lower back region we have what we call the lumbar vertebra. So in between the vertebra we have a disc in between the vertebra. So the disc will act as a cushion for shock absorption at the back region. So there are certain cases where the disc problems will lead to lower back pain. So the disc problems, the disc act as a cushion, and the problems with the disc will include disc bulge. If the disc bulges, then we have herniation. Herniation just means slipping of the disc, then degeneration with age. So what that means is that within the disc there's usually a nutrient and water supply that supplies the disc. If with age the water supply and the nutrient supply to the disc will reduce, and also due to weight bearing, the disc will degenerate with age, and this can irritate the nearby nerves, causing leg pain or sciatica. So those are the disc causes, the problems that are related with the disc. We have disc bulge, herniation or a slipped disc, then degeneration that occurs with age. Then the third cause, we have muscles and ligament strain. So this often occurs with overuse of the muscles or ligaments, sudden movement. For example, if I would like to turn to face the back, if you do sudden movements, usually it will lead to lower back pain. Then lack of conditioning. This means that you live a sedentary lifestyle. So this is very common in desk workers and athletes. Muscle and ligament strain often result from overuse, sudden movement, sudden twisting movement, and lack of conditioning. Then the fourth cause, we have the degenerative changes. So as we age, the joints will wear down, the disc will lose hydration, and mobility will reduce. So as we grow older day by day, our joints wear down. Why does it wear down? It is due to the weight-bearing activity that the joints carry out day by day. Then they lose hydration, the supply of the nutrients and water to the disc. This will reduce. Disc lose hydration, then mobility reduces. Of course, as we age, there's rigidity that is related to the bones and the muscles, which reduce the mobility. This doesn't always cause pain, but sometimes it does cause pain. So the fourth cause, as I've said, is the degenerative cause. Degenerative changes where the joints wear down, the disc lose hydration, and your mobility will reduce. Then we have the fifth cause, which I have categorized as serious causes. So this is rare but important, and these include things like infection. We have infections, then we have fractures. So if you have fractures at the back region, then tumors. Tumors basically means cancers. So you may have things like osteosarcoma of the back region, then severe nerve compression. So these will require urgent medical attention. That's why I categorize them as serious causes. So to recap on the causes of the lower back pain, we have the mechanical causes, which are the most common causes, and these are related to the posture, the movement, and the daily habits. And the examples here, we have poor sitting posture, heavy lifting incorrectly, your weak core muscles, and sudden strain or injury. Then we have disc problems. Disc problems include disc bulge, herniation, and degeneration with age. Then muscle and ligament strain that occurs with overuse, sudden movement, and lack of conditioning. Then we have degenerative changes. The joints wear down, hydration decreases, and mobility reduces. Then you have serious causes that include infection, fracture, tumors, and severe nerve compression. So those are the causes of the low back pain. Then what are the red flags that the patients should know? What are some of the red flags that are related with the back region that clients should know? So if you experience loss of bladder or bowel control, so this is whereby you have incontinence with the urine outflow and the fecal outflow, that is what it means, loss of bowel or bladder control. So that is a red flag. If you experience incontinence, which means that you can no longer control the defecation and the urine output. Then severe unexplained weight loss. So if you experience severe unexplained weight loss, usually of more than 10 kgs, that that is a red flag. Then persistent night pain. So if every night you experience persistent pain that is sharp, then that is a red flag. Then we have progressive leg weakness. So whereby the legs weakens progressively. Then history of trauma. If you have ever had a trauma, example like a fall, that should be a red flag, and you should seek medical evaluation immediately. Since most of the back pain is harmless, but these signs usually matter. So what are the red flags? As I repeat again, you have loss of bladder or bowel control, as in the case of urinary and fecal incontinence, then severe unexplained weight loss, persistent night pain, progressive leg weakness, and history of trauma. These are some of the red flags that the patients should know. Then many patients usually ask, how do a physical therapist or a clinician know what is wrong? Let's look at the clinical assessment, how the professionals will evaluate your back. So here is how they do it. Number one, we have history taking. So in history taking, what we usually ask is the onset of pain. How did it start? When did it start? Then we have the aggravating factors. Aggravating factors are things that worsen the pain. Those are the aggravating factors. Then we have previous injuries. Do you have any previous injuries before? Then occupation and lifestyle. Occupation is very important, as it will help us know of the ergonomics, and also lifestyle. It will tell us whether you do sedentary or you are actively engaged, and this will help give the clues immediately. So after history taking, where we check onset of pain, the aggravating factors, previous injuries, your occupation and lifestyle, we proceed to physical examination. So these may include posture analysis, where we analyze your posture, your sitting posture, your walking posture, Then movement testing, this whereby we check how you basically move. For example, at the back region, we check the range of motion of the forward bending, backward bending, lateral bending. Then we may move to the hips where we check for the hip flexion and hip extension, then also the knees. Then palpation of the muscles, this whereby we use the hands to feel for the tenderness of the muscle. So that's what is called palpation of the muscles, use of hands to feel. Then neurological screening. Neurological screening is whereby we use things like special tests. Examples of special tests, we have straight leg raise and slump test. Those are just some of the examples. There are several examples of special tests. Then we also look at the strength, your muscle strength. We check it, your muscle power, how strong can you resist a movement. Then we check your reflexes. We check your reflexes by using what we call the reflex hammer. Then sensation. This whereby we'll check your feeling of things. Then this help us to identify the nerve involvement, especially with the strength, reflexes, and sensation. This will help us check for nerve involvement. Then we have the functional testing. So we began by, under the clinical assessment, history taking was number one, then physical examination, then now we are looking at functional testing. So under functional testing, examples of the things we have here include bending forward, so forward bending, backward bending. Of course, while you are standing, your walking patterns, how do you walk, your core stability, how stable is the core muscles. So this will help in guiding the treatment planning. So that was all about the clinical assessment, how your clinician will be able to evaluate your back. Number one, we have history taking, whereby they check the onset of pain, what aggravates it, what makes it worse, any previous injuries, your occupation and lifestyle. Then they also look for physical examination. This is where we have posture analysis, we have movement testing, we have palpation of the muscles, and neurological screening. Here we check for the muscle strength, your reflexes, and your sensation, as this may help us to get any clues about nerve involvement. Then we have functional testing. Examples here under functional testing, we have forward bending, backward bending, we have walking patterns, the stability of your core muscles. Then let's now look at your the rehabilitation principles that are used. This is where the recovery will begin. What are some of the rehabilitation principles that are used to help you with your back pain? So number one principle that I always say is that movement is medicine. Movement is medicine. So bed rest is rarely recommended now in low back pain. We do not usually recommend bed rest in low back pain unless in cases of fractures, in cases of acute, in cases of infections and tumors. Then we have gentle movement, that is still under number one principle, that movement is medicine. So gentle movement is usually recommended. Why? This will help reduce stiffness. It will help improve circulation. That is, it will help improve your blood flow, your nutrient supply, and your waste, metabolic waste clearance. Then it speeds healing. Movement will speed healing. So you should avoid prolonged activity. You should avoid prolonged activity. So number one principle is that movement is medicine. We do not usually recommend you to have bed rests if you happen to experience back pain. We encourage you to do gentle movements as this will help reduce the stiffness that you have. It will also help reduce muscle spasm, which is involuntary muscle contraction. It will improve your circulation and speed the healing process. Then the second rehabilitation principle is exercise therapy. So here the core strengthening is the key. The core strengthening is the key. So we have number one, the abdominal muscle strengthening. So abdominal muscles, so these are the abdominal muscles, the muscles that you find at the tummy region. Those are the abdominal muscles. So we do what is known as core strengthening for the abdominal muscles. Then we have back extensors. So the muscles at the back region that help with your extension motion. Then we have hip stabilizers. Hip stabilizers, we have examples. We have the gluteus medius and the tensor fasciae lata. These muscles will help stabilize your hip region and this supports the spine. The third principle is posture correction. So small daily habit patterns, and this includes sitting upright. So you should usually sit upright. Then ergonomic workplace. So if you are employed in a working setup, we improve your ergonomic workspace. Then we teach on proper lifting techniques. So this is where prevention will start. Then another principle is pain management techniques. So how do we manage pain? So your physical therapist may include the following to help you manage pain. Number one, we have manual therapy techniques. So these may include things like PNF. We have things like muscle energy techniques. These are just some of the examples of the manual therapy techniques that will be used. Then we have heat therapy where they apply heat. Then stretching exercises. Stretching exercises for your back to help reduce tension, to help reduce muscle spasm. Then education and reassurance. This is whereby you are educated on the how to prevent or how to reduce the back pain if you have it, and you are given reassurance. So pain relief will improve your function. So pain management techniques. Those are some of the examples of the pain management techniques that will be used. Then we have the fifth principle will be gradual return to activity. So as you return to activity, you should avoid sudden overload. You should avoid sudden overload. You should progress gradually in your walking patterns, the functional exercises, and the strength training. Consistency here will help beat the intensity. So what should you focus on? You should focus on progressive return to activity. How? By use of progressive walking, functional exercises or activities, and strength training. So those were the rehabilitation principles that are used for your recovery. Remember, this is where the recovery will begin. And the first principle was that movement is medicine. So we usually encourage you to move. If you happen to have low back pain, then exercise therapy as will be guided by your physical therapist. Then posture correction where posture screening is done and you are taught on the best economics to do. Then pain management techniques whereby you are taught on the your physical therapist will use various techniques to help manage pain, then gradual return to activity. Let us now look at the common myths about the back pain. So let's clear some of the misconceptions that people have. Number one misconception is that back pain means permanent damage. This is often wrong, as back pain is often reversible. It can be reversible through conservative management or surgery, then rest completely until pain stops. So that is also a misconception. You should have controlled movement to help in recovery. Then another misconception is that surgery is always needed. Most cases will respond to conservative care. However, if conservative care doesn't work, you will be referred for surgery. So those are some of the common myths or misconceptions about back pain. Number one is that back pain is permanent. No, back pain is not permanent. It is often reversible. Then number two is that you should rest completely until pain stops. No, we advise on controlled movement to help with recovery. Then the third misconception is that surgery is always needed. So most cases will respond to conservative care. So education will help reduce fear, and fear amplifies pain. So the fear that you have will amplify your pain. However, education will reduce your fear. So if you take only 3 messages from today, what should it be? Number one, back pain is common and often manageable. It is common but manageable. Number two, movement and exercise are powerful treatments. Movement and exercise are powerful treatment. Number three, early professional guidance prevents chronic problems. Early professional guidance prevents chronic problems. So your spine is strong with proper care, adapts and heals. Your spine is usually strong, and with proper care, it adapts and heals. Thank you for investing in your health today. Stay active, stay informed, protect your back. Stay active, stay informed, and protect your back. I thank you for being with me up to this point. If that made sense, please click the like, subscribe button. Thank you.